Namaskaram, I'm Dr. Tejaswi, consultant neurologist. Today, let's discuss about something that sounds very scary, which is called craniotomy. So, the word craniotomy feels like we are opening the skull and removing a part of our brain. Well, no. So, let's learn something that is very important to understand what it is and when is the situation when we actually need it. So, this is a brain. So, we have a skull and few layers of tissue around the brain which covers it. There's a fluid where the brain floats, and over this, there will be a skull bone. So, what exactly is craniotomy? Craniotomy is actually a life saving procedure where we only remove that particular skull. It's just opening of the skull bone to reach the brain. So, where do we do it? So, craniotomy is done for various procedures, like if there is a brain tumor here, if there is an infection, if there is a surrounding layer tumor, if there is an injury here, which is causing swelling of a particular part of the brain. And like we all know, brain is a closed box. So, if the skull is just around the brain, and if the brain has swollen for whatever injuries, let it be stroke, let it be bleed, let it be concussion, there is a tendency of swelling because that is how any injury heals. So, when the swelling happens, because it's a closed cavity, there is no space. So what do? We actually give the brain some time to heal and let the swelling happen. So for that, we do a life saving procedure, which is nothing but removing this part of the skull to give it space to expand and take its own time to heal. Because if we don't do that, the pressure is going to press the normal parts of the brain, which is life threatening. So, craniotomy is not a severe surgery where we cut open the brain or do something into the brain. It is simple, very basic life saving procedure of opening the cranium, that is nothing but the skull bone covering the brain, so that we give time for the brain to heal and did not damage parallelly the other parts of the body or land in a coma in the process of healing the primary injury. Same with the tumors as well. So, thanks to the advancement in the technology, today we have a very precise neuro navigation. Most of the time, before we even open the skull, we are very accurately precise about where we are going, how we are reaching it, and how far we are going, what is the time that might require, and what is the intention of doing it. Not every time the intention of doing this procedure will be touching the brain or removing something. Sometimes it is only going to just give it some space to heal. So with the neuro navigation, we are very precise, so there is nothing to worry about. And something more important, that we might be hearing something about awake craniotomy. Awake craniotomy is nothing but patient is absolutely awake when the procedure is happening. How can we do that? You can imagine, because even a skin cut is extremely painful. How can you not have an anesthesia while this is happening? Well, fun fact, brain is painless. Only the skull, bone, the skin layers are painful. But when you reach the bone, if you touch the bone, or even if you squeeze the bone, you cut the brain, none of these are actually painful. Brain is absolutely painless tissue. So why is it important? Though it is painless, that doesn't mean you should not be given anesthesia, right? No. The very reason why we do an awake craniotomy is, in particular situation, when we are trying to remove a particular part of the damage